Welcome back to Africa Science Focus, the science and development show from SciDevNet. I'm Ogechi Kenyo. On this week's episode of our Science Explained series, we're finding out about the dapivirine vaginal ring. This is an innovative device designed to reduce the risk of human immunodeficiency virus HIV infection in women. The World Health Organization defines HIV as an infection that targets the body's white blood cells and weakens the immune system. It can lead to acquired immunodeficiency syndrome AIDS, which is the most advanced stage of the disease. HIV is primarily spread through bodily fluids such as blood, breast milk, semen, and vaginal fluids. The dapivirine vaginal ring is worn in the vagina, releasing the antiretroviral drug dapivirine over 28 days to provide protection against infection. The ring has been approved for use in 11 countries in East and Southern Africa and is now available for use in 6 of these countries. One of the countries that has approved the ring for use is Kenya, and our reporter Bunmi Yekini has been finding out about the impact of this device. Bunmi spoke to Patriciah Jeckonia, the Program Manager, Policy and Partnerships, LVCT Health, a non-governmental organization in Kenya.
Prevalence amongst women is 5.3%. Compared to that of men at 2.6%, it's double the prevalence of men if you're comparing the two.
Why is it so?
A lot of factors. I think number one would just be the biological factors. That the women reproductive organ is, it's a large surface that is exposed, to the virus. Like if a woman is exposed to HIV, there's like really a large surface area within the reproductive system because women are receptors. And that just means that, the likelihood of getting HIV is actually higher. There are other vulnerabilities when we look at issues around gender inequalities. We are seeing more women being at a place where, number one, they're not able to negotiate for safer sex. They have low income, and so they engage in other activities, sexual activities that could be, putting that more at risk. Like if you look at sex work, we have more women, in sex work, and so just looking at again issues around poverty really contribute. And also the sexual gender-based violence is also a huge contributor to this.
Dapivirine ring could make a difference in women's health in Kenya. But while it has been approved for use, how available is it?
Kenya approved the dapivirine vaginal ring in July of 2021. And we only have the ring in studies. So currently our biggest study is an implementation science study to generate more evidence to be able to move us to the point of rolling it out programmatically into other facilities. So the availability currently is restricted to studies only.
So when it is eventually approved for you, for every woman, what do you think it will mean for Kenyan women to have the DRV?
So for me, choice is key. Choice is something that we have seen in various sectors in our everyday life. That someone would like one and not like the other for various reasons. If we take simple examples, just like colors, you ask anyone randomly, which color do you like? You get all sorts of answers. And that goes on to tell us that if you were to make clothing, for example, in just one color, there are people who will never buy it because they just don't like that color. So I see an opportunity for women to prevent HIV. I see an opportunity for women to choose what works for them when they are at risk. Again, just noting that, PrEP is not for life. It's not for use for life. It's in your seasons of risk. So I see an opportunity, women cycling in and out of the various methods because they all work very differently. Oral PrEP, women have to swallow it daily. And then the vaginal ring, you insert it and it stays there. You remove it after 28 days. And then you insert it again if you're still at risk. So really the methods and how they are used, how they're delivered is different. If a woman is looking for a product that doesn't have potential HIV, drug resistance, the dapivirine ring would be a good option because it's localized, just within, the vagina. When you want a systemic kind of product, now we do have oral PrEP. So I see a great opportunity for choice, and women will definitely, find another option that could work for them.
Akhona Gxarisa, a participant in the dapivirine vaginal ring research study in South Africa, shares her experience of using the ring with Bunmi.
I was recruited to join the dapivirine ring clinical trial in my community. I participated in the research because I wanted to protect myself from HIV and to also be part and also to contribute in the research. We insert it in your vagina and it stays for a month or so. So you don't take it out. You don't, as you put it in the research center, that's where you're going to take it out after a month. So you go about your business as per normal. Nothing changes because it's very, very comfortable to wear. So it just stays right there.
Does it feel different when you have DVR on while having sex?
For me, sex was normal because, as I said before, it's very comfortable to wear because, remember, you insert it in your vagina, but it goes straight to the mouth of the cervix. So it's there, which is very far.
Mm-hmm.
The mouth of the cervix it's very far up the vagina. So the sex was normal for me. My partner didn't feel anything, and like nothing changed. Nothing changed. Everything was normal.
Okay. Now, are there any side effects while using it, and what are the side effects?
For me, I've never experienced any side effects.
Okay.
But I was told that the side effects includes urinary tract infections and rash. And so should one experience any of these side effects, then you need to immediately alert the research clinic so they can treat you.
Is the DVR available for use in South Africa for women who want to use it as an option?
It is available, but unfortunately for me, I live very far from the clinic that has it now.
Mm.
So I can't have it now, but like I know it's gonna be contributed nationally. So we're waiting for that so we can all have it.
If you have an option to choose between the previous protection method you're using and this DVR, which one would you opt for?
I would choose the ring, obviously.
Why?
I would choose it because I've used it before, so I know it's very comfortable to wear. Secondly, it's very discreet. No one knows that you have something in your vagina. So you don't have to seek permission from anyone. Yeah. So for me, it is a game changer. Okay.
So once the DVR becomes available for all women to be able to access in South Africa, what do you think this means to women in that country?
It will mean a lot. It will mean a lot. Don't want to lie. It will mean a lot to the women of South Africa because the HIV rates here are very high. And women are very vulnerable because, with men, you don't even know. Sometimes it might seem like this person is like dating only you, as to find out that he has other women outside. So this will be a game changer for them. And also it's going to give them power to be in control of their sexual health.
Akhona stopped using the ring due to lack of access, a common issue that sexual and reproductive health organizations are working to address. Mbali Jonas, Marketing and Communications Coordinator for Fast Prep, an HIV prevention project in South Africa, discussed their efforts to increase access to preventive measures.
Fast Prep is an HIV prevention project that operates within the Klipfontein and Mitchells Plain sub-district in Cape Town. So we offer 3 methods of HIV prevention, which is the oral PrEP, the dapivirine, as well as the injectable PrEP. However, we also offer family planning services. We also do HIV testing. And lastly, we do STI testing and treatment. So we use a differentiated service approach where we have mobile clinics that go to shopping centers, shopping malls. We also go to schools. And then we also have, or partnered rather, with local government clinics where young people can also access our services. And then we also do youth clubs that are held on Saturdays, where it's really young people coming together and discussing a topic that is relevant to them around sexual reproductive health. And then they're also able to get PrEP. We also have a courier service of oral PrEP, dapivirine, as well as STI treatment. So our target audience or demographics for Fast PrEP, it's a woman between the ages of 15 to 29 years, a man or trans person also between the ages of 59 to 29 who has sex with men, and then men between the ages of 15 and above who have sex with women, and you must live within the Klipfontein and Mitchells Plain sub-district. And then we also do brand activations. So this really speaks to when we enter into a new community and people within that don't necessarily know about our services and Fast PrEP. So we will do an activation which is more like announcing, within the community that we are Fast PrEP and these are the services that we offer.
Although the dapivirine ring reduces HIV risk for women who have access to it, its availability is limited in sub-Saharan Africa. Nigeria is one of the countries where it is not yet available. Bunmi spoke with Professor Oliver Ezechi, Director of Research at the Nigerian Institute of Medical Research and Professor of Maternal, Reproductive and Child Health at Leeds City University. She wanted to understand the reasons behind its unavailability.
One of the things, according to the country laws and NAFDAC, for you to introduce a drug into Nigeria, it has to be evaluated in the country. So that the dapivirine ring is there to be evaluated in the country. So we cannot introduce it. So until that is introduced, or that is researched into, in at least 2 centers, one in the south, one in the north, and then approved by NAFDAC, then registered by NAFDAC, that way it can be introduced in the country. Yes, why that is important? I think what we have now, I have this I call comprehensive HIV prevention. We have now is sufficient. HIV self-testing is for everybody. It's not only for male. The current pre-exposure prophylaxis available is for men and female. That's readily available. So we already have something already in the country that when people use can prevent HIV transmission. However, whenever the vaginal ring comes in, that will be an addition.
Is PrEP both oral and injectable? Is it readily available for?
For now in the country, the oral PrEP is readily available, both in the facilities and the pharmacy.
That's the oral.
Yes. Injectable is not yet available in the country.
Why?
I keep telling you, you can't introduce new drug in the country without going evaluation.
So it's only the oral PrEP that we have in Nigeria.
Yes, it's not available. So when they now complete evaluation research, at least 2 centers across, and it's registered by NAFDAC. We have a law. Nigeria is not in top ground. We have a law. And the efficacy and safety of those drugs among Nigeria have to be evaluated before they are registered.
Professor Ezechi notes that the ring's high cost is a significant barrier, limiting access and restricting choices for many African women. Patriciah echoes this concern in her discussion with Bunmi.
The numbers we are looking at is $12 to $15 per ring. That's the range. Okay. When I look at Sub-Saharan Africa, that poses a challenge. It poses a challenge when we look at the women that we are targeting with these products. These are women in spaces of poverty, women who are engaging in, sex work, and so they live per day, per income. And being able just to budget to afford the $12 to $15 when we have families that live below, the dollar is a Hercules task for women. If this is going to be available let's say in pharmacies and someone has to buy, I see that being problematic, being a missed opportunity. We do know that there is definitely a segment of women who are able to afford, but the majority that are being targeted may not be able to afford it. And case in point, take an 18-year-old girl who's probably just clearing high school, is getting into college, totally depends on the money they're given by their parents. And if you take $12 to $15, that could mean someone, pocket money, maybe for a week or two. So that for me is unaffordable for majority of the women in Sub-Saharan Africa that would benefit from this product. So there's definitely a lot of advocacy currently going on to bring this cost down to what, number one, countries can afford to buy. Even as we look at the reduction in donor funding, we are seeing a point where our countries will have to buy this. Cost is definitely at the top of the list. And they also look at for quantification in terms of how many women would actually benefit from this. So I see that being problematic if the cost continues to remain that high.
Now, experts are calling for local manufacture of DVR as a way of having it at a lesser price and making it available for countries of need, among other reasons. Is this a feasible suggestion?
I think it is, and I'm a great supporter of local manufacturing. And not just local, that it be done in our individual countries. For me, even the first point is just getting this being manufactured in Africa. It would reduce the cost significantly. We know there are countries that may not have the capacity at the moment, but I think the intentionality to get to a point where there's fair competition in the market. There's also need to invest in building the capacity in various African countries for the manufacturing of the ring and other products that will come in the market. So definitely, yes.
Despite the availability of preventive tools like dapivirine ring, HIV rates remain high in certain parts of Sub-Saharan Africa. Patriciah discussed the challenges and barriers that hinder effective HIV prevention.
If I think about the challenges, I think number one for me is the low perception of risk amongst girls and amongst women. Ordinarily, you find if you're introducing a conversation around HIV and HIV prevention, most people are not interested because they just think they are not at risk. But when we now place the statistics, it becomes an eye-opener that, we still are getting new infections, and yet we have invested so much in the prevention methods. I think, and having said that, the second issue for me would also be access. Okay. That we have experienced, stockouts generally. In the various countries, you find there are stockouts of, say, condoms. You find some countries have had experiences of stockouts in even oral PrEP. The assessment for someone to be given PEP, for example, varies and sometimes is dependent on the provider that is serving and their understanding of the policies. So access becomes a challenge. And again, when you look at access, the factor of age is a major issue. In Kenya, for example, right now, we allow girls from 15 years to access oral PrEP.
Okay.
But for the ring, currently, it's 18 years. So it means for the below 18, they still have only one, which is oral PrEP. And that, again, is it moves from country to country. We do have issues, again, around access where pregnant and breastfeeding women are not allowed to use certain products. We've had countries that did not allow women to use oral PrEP, pregnant and breastfeeding women to use oral PrEP. There are countries that have refused that they cannot use the ring. So this kind of barriers to access are a major issue when it comes to lowering the new infection. Again, the gender inequalities, the socioeconomic status of women is still something that we need to work on. And so when we look at some programs like Dreams that comes in to really support and boost the girl child and empower the girl child also to, be able to make certain decisions, we need to think as African countries, are we able to sustain such programs? And if not, what can our countries offer? Because there's definitely still going to be a gap. If PEPFAR takes away, say, Dreams money, there's going to be a huge gap. And we have a lot of these girls that will just sink back to that cycle of poverty, the main reason why they got into the program. I think the other issue for me in terms of challenges is communication. A lot of our communication is not, it's not human-centered. It's not geared towards behavior change. And having known that HIV is largely a behavioral, disease, we need to rethink how we do our communication around HIV and even how we sustain the communication work. Because, again, a lot of our communication is donor-funded. When there's no donor money, you don't see any advert, you don't get any information, and yet the problem is within the country. Lastly, it will be funding. It's a high time, and this, we cannot overemphasize the need for our African countries to put in money for the HIV response. Especially now that our countries are talking about universal health coverage, we're talking about primary health care. Can we have the package for HIV prevention and treatment incorporated in such programs so that our countries are able to start allocating money right now and continue doing that incrementally?
All right. Does Kenya's health budget capture the HIV prevention, treatment, and vaccine research?
I think for research, it remains like a blanket budget that supports research, and it will be difficult to pull out specifically what is allocated for HIV prevention. When we look at the analysis that Kenya did on the KNASA of 2022, we had out of 100% of funding for HIV, only 9% was allocated for HIV prevention. And when we look at the actual expenditure in HIV prevention, 57% was the contribution of the US government. Global Fund contributed 20%, NGOs and foundations 13%, while the Kenyan government contributed 8%. So that is really like that's a very small percentage. Looking at a country that is still recording, new infections in the 20s of thousands. We need to definitely have our government put in more funding for prevention. As we always say, prevention is better than cure. We save dollars when we prevent, an infection. And when we look generally, like in terms of how the expenditure was how the expenditure in the health sector looks like, we have 69.1% contribution from donors. We have 4.5% as out of pocket in terms of household, 2.7% from corporations, and 23.6% from government. So that really just gives you the general picture of how the health budgeting looks like, and definitely a lot of advocacy and push needs to be done to get the government to allocate more for prevention.
Why not have a huge awareness program in Kenya where you can have the community people sensitized about the danger or the sides, the negative sides of HIV and AIDS?
The real sensitization in pockets of the population, depending on the funding available. And that's why I was saying that the saddest part for me is we've had HIV in Kenya since 1984. And close to 40 years down the line, our knowledge levels, for around HIV still remains quite low. I think at about 56%. In terms of knowledge, people giving you the correct information about HIV. But I think as I have worked across, different countries in Africa and speaking to girls, there's the major fear, of becoming pregnant compared to getting HIV, which is it's shocking, because they'll tell you, if I get HIV, I have ARVs, I'll just take the medication. And the medication is getting better and easier to take each and every day. But now, when people get to the actual taking of ARVs every day, it is that same population that is failing us. They are dropping off treatment. They are not adhering to their treatment. They are taking drug holidays. And we are seeing a number of them not reaching viral suppression. So I think it's one thing for them to just quickly say, I'm more afraid of pregnancy because people can see it, than HIV. But when the rubber meets the road, even taking that ARV has actually become a challenge. So I totally do agree that, yes, we need more investment in terms of talking about HIV and penetrating spaces like the religious sector. That is constantly against discussions around sexual matters and the dangers it can have. But I think these are critical conversations where everybody must be a partaker, must be an ambassador, must be, an awareness creator, and freely talk about, the repercussions that are there if somebody engages in unprotected sex and they end up getting HIV. What does this mean for them and for generations to come? Because we have to make a decision to be the generation that will actually end HIV. If we don't, we keep passing it to the next generation and the next generation. It is a cycle that may never, reach an end. So awareness creation is really key. And that, I think, also calls for a lot of partnership. Instead of waiting for donors to give us money for demand generation, it's also looking at the private sector. How can we partner with the private sector, to do this kind of awareness generation across the country?
That's all from us at Africa Science Focus today. If you want to find out more, head to the SciDevNet website. That's www.scidev.net. Today's show was produced by Alice Hest, with editing by Titilope Fadare and Ogechi Ekianyao, and reporting by Bunmi Yekini. I'm Ogechi Ekianyao. Until next time, goodbye. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station.